Welcome to the presentation of Estimation of Gingival Crevicular Fluid Pentraxin 3 in Periodontal Disease, presented by Al-Azhar, Assistant Lecturer of Biochemistry, Faculty of Pharmacy, Badr University in Cairo, under supervision of Dr. Abeer Ibrahim, Professor of Biochemistry, Faculty of Pharmacy, Girls Al-Azhar University, Dr. Niveen Raghi, Professor of Oral Medicine, Periodontology and Diagnosis, and the Vice Dean of the Faculty of Oral and Dental Medicine, Future University in Egypt, and Dr. Nisreen Nabil, Associate Professor of Biochemistry, Modern Technology and Information University. The presentation outline, first of all, the background. We'll speak about the periodontal diseases, gingival crevicular fluid, Pentraxin 3, and Pentraxin 3 in periodontal diseases, then the objective, subjects and methods, results, and conclusion. First of all, the periodontal diseases are a group of inherited or acquired disorders of the tissue surrounding and supporting the teeth, collectively called periodontium. These diseases might be developmental, inflammatory, traumatic, neoplastic, genetic, or even of metabolic origin. Their progression depends on the crosstalk between the causative microorganism, which is mainly the gram-negative bacteria in the periodontal biofilm, and the host response to it. The term periodontal disease usually refers to the common inflammatory disorders of gingivitis and periodontitis. The epidemiological data from the CDC confirmed the periodontitis of very high prevalence of more than 47% of adults, and the severe periodontitis is a leading cause of tooth loss and can adversely affect the systemic health because it's associated with an increased risk for atherosclerosis, diabetes, rheumatoid arthritis, and adverse pregnancy outcomes. Regarding the periodontal anatomy, the healthy periodontium or the healthy tooth, the gingiva color on the right side is pale pink and the bone level is high, while in the presence of the periodontal disease, the inflammation prevails. We can see the gingiva becomes red in color, the bone level decreases due to bone resorption, and periodontal pockets form. The gingivitis is the mildest form of periodontal disease. It's highly prevalent and freely reversible by simple, effective oral hygiene. The disease is limited to the soft tissue compartment of the gingival epithelium and connective tissue. While the periodontitis is a more severe form of periodontal disease, which is an inflammation that extends deep into the periodontal tissues and causes loss of the supporting connective tissue and alveolar bone, it leads to the formation of soft tissue pockets between the gingiva and the root. The severe periodontitis causes loosening of the teeth, occasional pain and discomfort, impaired mastication, and eventual tooth loss. The pathogenesis of periodontal disease. It starts with the conversion of the symbiotic microbiota present in the oral biofilm into dysbiotic microbiota in a susceptible host. Then the dysbiotic microbiota interacts with the complement and pattern recognition receptors, inducing inflammation. The prolonged inflammation leads to the formation of periodontitis, and the inflammatory tissue breakdown further increased the dysbiosis and the conversion of symbiotic into dysbiotic microbiota. The risk factors for periodontal disease could be divided into modifiable risk factor as smoking, education, and others that are non-modifiable as age, osteoporosis, hematological disorders, and others. The gingival crevicular fluid is an inflammatory exudate produced by the gingival tissue microcirculation in cases of inflammation. Its flow is increased during gingival inflammation and is the first sign of inflammation. It contains a rich array of cellular and biochemical molecules associated with the disease activity. The identification of biomarkers in the GCF is becoming increasingly important in the diagnosis and treatment of periodontal disease. The advantages of GCF collection are it's a non-invasive and site-specific procedure for diagnosing periodontal disease, as well as having a suggestive value of the disease status, also being a promising medium for evaluating the health status of individuals. The GCF could be collected at the margin of the gingiva or from inside the gingival sulcus as shown in the figure. The diagnosis of periodontal disease is traditionally based on using clinical scores of probing pocket depth, clinical attachment loss, and bleeding on probing. But the limitation of these methods is not being able to detect the disease before it has caused destruction, also the inability to reflect marked histological changes. Thus, advances in periodontal disease diagnostic research are moving towards methods whereby periodontal risk can be identified and quantified by objective measures such as biomarkers. Pentraxin 3. Pentraxin 3 belongs to pentraxins, which is a superfamily of acute phase proteins and an essential component of the humoral arm of innate immunity. It is the first long pentraxin identified and described as interleukin-1 beta-inducible gene in endothelial cells. It is regarded as a more efficient and independent biomarker of inflammatory diseases due to its extrahepatic synthesis. Thus, it represents a rapid marker for primary local activation of innate immunity and inflammation. This is the structure of pentraxin 3, which is characterized by the abundance of cysteine amino acid and the presence of the pentraxin signature. Pentraxin 3 is released from a different array of cells such as the polymorphonuclear neutrophils, the macrophages, the myeloid dendritic cells in response to different stimuli as cytokines, thus to be able to perform its numerous functions. The functions of pentraxin 3 could be broadly divided into innate immunity, including the complement activation, opsonization, and apoptotic cell elimination, and the other branch of the induction of inflammation and tissue remodeling. Regarding the role in pathology, pentraxin 3 levels were found to be elevated in numerous pathologies as cancer, cardiovascular diseases, infections and sepsis, in adverse pregnancy outcomes, and in autoimmunity. Pentraxin 3 and periodontal disease. Pentraxin 3 levels increased rapidly and dramatically in various chronic inflammatory diseases. Thus, pentraxin 3 could probably play a role in the pathogenesis of the periodontal disease. The objective: to evaluate the GCF levels of pentraxin in gingivitis and chronic periodontitis patients and compare them with the healthy individuals, to correlate the GCF pentraxin 3 levels with some clinical parameters of periodontal disease, to assess the diagnostic value of pentraxin 3 in the GCF as a potential biomarker for gingivitis and chronic periodontitis. Subjects and methods. The subjects were selected from the outpatient clinic of Future University's Dental Hospital between July and December 2015, divided into 3 groups. Group 1 was the healthy control, made of 20 subjects. Group 2, gingivitis group, made of 30 subjects. And Group 3, chronic periodontitis, was made of 30 subjects. All subjects completed an in-person interview on the current oral health status, history of dental diseases, procedures, and occupation. The inclusion criteria was as follows: both genders of systemically healthy individuals, patients who agreed to sign a written informed consent, and an untreated periodontal disease in the previous 3 months. While the exclusion criteria was any systemic inflammatory or immune disease which can alter the levels of pentraxin 3, the smokers, history of alcohol abuse, pregnancy and lactating females, females taking oral contraceptive drugs, and subjects who had an antibiotic treatment in the previous 3 months. All subjects completed the following: full history taking, clinical measurements recording, GCF sample collection, and then the biochemical investigation of pentraxin 3 and alkaline phosphatase levels in the GCF. For the GCF sample collection, The sites with the deepest probing pocket depth were selected, isolated with cotton rolls, and then the GCF was collected using perio paper strips, which was inserted into the gingival crevice until mild resistance was felt and left for 1 minute. Then it was transferred to 200 microliter phosphate buffer saline and then stored frozen at -20. For the biochemical analysis, the samples were brought to room temperature, mixed 3 times using vortex, and the strip debris was removed by centrifugation. Then the supernatants were used for the analysis of Pentraxin and alkaline phosphatase. This is the subject presentation for the healthy control, for the gingivitis, and for the chronic periodontitis. The results. The clinical data of the studied groups showed that the probing pocket depth, clinical attachment loss, and gingival recession and bleeding on probing were significantly increased in the chronic periodontitis group as compared to the gingivitis and to the control, and the gingivitis group was significantly increased as compared to the control group. The biochemical markers evaluation of the studied group. Firstly, Pentraxin 3. The levels of Pentraxin 3 were significantly elevated in the chronic periodontitis group as compared to gingivitis and to controls, and in gingivitis as compared to controls. The alkaline phosphatase also was significantly increased and differentially expressed between groups. The correlations of Pentraxin 3 with the other parameters. For the gingivitis group, Pentraxin 3 concentration showed a positive correlation with the probing pocket depth, the clinical attachment loss, and the alkaline phosphatase GCF levels. While for the chronic periodontitis group, Pentraxin 3 concentration showed a significant positive correlation also with the probing pocket depth, the clinical attachment loss, and the alkaline phosphatase GCF concentration. This is the ROC curve to differentiate between gingivitis and chronic periodontitis with Pentraxin 3, which showed 100% sensitivity and specificity. The conclusion. The current study could conclude that the positive correlations between GCF Pentraxin 3 levels and the clinical parameters suggests that Pentraxin 3 is involved to some degree in the complexity of the periodontal inflammation. Pentraxin 3 has a potential clinical value as a biomarker for periodontal disease and is useful for indicating the inflammatory status of the periodontal lesion for monitoring of the disease activity. GCF Pentraxin 3 showed high sensitivity and specificity in differentiating between gingivitis and chronic periodontitis. Thus, it could have a clinical implication in the in situ diagnosis of the periodontal disease with regard to the inflammatory status of the patient. Thank you.